Hello, this is Sayeda Sabakatami. I'm gonna be do the interview with my patient. So regarding that one, I wanted to do the room scanning, and then after that, this is the papers I'm gonna be using. So I'm gonna be write it so I don't forget it anything. I'm gonna be scanning the room, trying to stay. Okay, perfect. And during this interview, I'm not going to be using any outside resources, and I'm going to be just started to interview with the patient. Hi, this is Saba Katami. I'm going to be your nurse today, FNP, Family Nurse Practitioner. Before we started, I want to let you know I'm going to be submitted this video in the YouTube for purpose of my classes. Do you give me a consent so they are able to see this video?
Yes.
Thank you so much. Can I have your name and your date of birth, please?
My name is Shadia Gabda, date of birth February 15, 1993.
So, what is the reason you're coming today, or what are we gonna be
Just
doing?
the annual checkup.
Annual checkup. Oh, appreciate that. When was the last time you do the annual checkup?
It was last year.
Perfect. Did you have any abnormalities?
No.
Okay. When was the last time you had the eye exam?
It was last year.
What about the dental exam?
6 months ago.
6 months ago. And our recommendation for the dent, for the teeth and dental, we want every 6 months you're checking. For the eye exam, either 6 months or at least a year. Okay. Are you sexual active?
I am.
So, do you have a partner, husband, or?
I have a husband.
Perfect. So first of all, are we consider you a girl, boy, or what is your gender?
Girl.
Girl. What is your ethnicity?
Caucasian. White
Caucasian.
and Caucasian.
Perfect. So you're married. So do you have a one single partner or multiple
I
partner?
have one single partner.
Perfect. What contraceptor do you using? Like do you use condom? Do you use birth control? What are you using?
We use condom.
Okay, perfect. Have you ever had any HIV, any infection like STDs, HPVs, or any other those kind of things as like diseases? Perfect. So, what is your job?
I'm even planner.
Perfect. Did you study?
I did.
Perfect. What did you study?
I studied food engineering, but I'm not doing it.
Perfect. Do you have any financial issue to providing food, medications, or something like that? Okay. Where do you live?
I live in a home, apartment.
Perfect. Are you live by yourself or are you with your
With my
husband?
husband.
Perfect. So, do you guys have any children?
No.
No. Okay. Perfect. So, do you do okay. What kind of religious we should be consider you?
I'm just
Just
believing
none.
that,
Okay.
yeah.
Perfect. Okay. So, any specific practice you follow?
No.
No. Okay. Perfect. So, my next question is: do you smoking?
No.
Any tobacco?
No.
Vaping? Drug? Have you ever had a drug prescriptions? Like sometimes they use a marijuana or something. Have you ever used marijuana?
No.
Do you drinking?
Just party drinker.
Party drinking. What kind of specific drink you drinking?
Tequila.
Tequila. Do you know how much you drinking every
Maybe
time?
like each time 2 shots.
2 shots, perfect. It's like every week or every other week?
Every other week.
Every other, perfect. Do you drinking coffee?
I do.
So how many coffee?
Every morning one.
Once a day. Okay. Do you do exercise?
I do.
Okay.
3 times a week.
Perfect. Do you follow any specific diet?
Mediterranean diet.
Perfect. So do you have any food allergy?
I do.
Medication allergy?
I do.
Environment allergy?
No.
Okay. Perfect. So as you mentioned, you said you exercising 3 times a week. So have you ever feeling any weakness, numbness in your hands, in your legs?
No.
Okay. So now I'm going to be started to asking a couple questions regarding like head to toe, and I want to just you specifically answer me. So when you went to the eye doctor, did they find it any do you wearing any glass?
No.
Any eye contact?
No.
Perfect. So did they prescription for you any eye contact or any glasses?
No.
No, perfect. So do you ever have any inflammation, infection in your eyes?
No.
Have you ever had a double vision or
No.
hard time or blurred
No.
vision? Okay, perfect. So you see me clear right now?
Yes.
Okay, perfect. So have you ever had an eye problem?
No.
Like eye pain, I mean.
No.
No, perfect. So, and your exam last year was okay?
Yes.
Perfect. Have you ever done the blood exam?
Yes.
So did they prescription you a blood routine?
Yeah, just a routine exam.
So do you remember which one? Like a CMP, TSH, which one did you do? Did they do?
They want that they check cholesterol, they check the diabetes.
Okay,
these
perfect.
things.
Did any abnormality on that?
No.
So, do you know what is A1C?
The one that they check the blood sugar.
Perfect, yes. Do you remember how much was yours?
I do not remember.
So, do you-
But it was okay.
It was okay. So the range we are looking for, we usually, if the patients have more than a 5.5, so we just consider like a pre-diabetic, and we don't want it more than a 6 or 6.1. So a patient don't remember it, but with consideration, usually we're looking on the patient chart, make sure patient's chart doesn't show it any A1C higher than the normal range. Perfect. Any high cholesterol?
No.
So no high blood sugar. Am I
No.
right? Have you ever had a thyroid problem?
No.
So do you take any medication for the thyroid?
No.
Have you ever feeling inflammation on your lymph nodes?
No.
So the lymph node is usually under the neck and close to the ears. Have you ever feeling any problem? Okay.
No.
Have you ever had a hearing problem?
No.
So do you using any hearing aids?
No.
So do you feel it sometimes like discharging from your ear?
No.
Okay, so have you ever have a hard time to hear it?
No.
Perfect. What about the smelling? Do you have a hard time to smell anything?
No.
Have you ever have a hard time smelling?
No.
Did you do the nose surgery? Have you ever
No.
had? So have you ever have a bleeding nose?
No.
So what about discharge?
No.
So and do you smelling perfect? Like have you ever had a problem for smelling anything? Okay, perfect. So about your mouth, have you ever had any threshold or lip any threshold in your mouth?
No.
So how about have you ever feeling like swelling on your lip?
No.
What about cavity on your teeth?
No, I don't have any.
No.
Right now.
Okay. When was the last time you cleaned your teeth?
It was a year ago.
A year ago. Perfect. So we usually asking the patient to follow up every 6 months. Okay. Did you see any abscess on your teeth?
No.
No pain on your teeth?
No.
Okay. How about did you see any white patches on your tongues?
No.
Do you have any hard time to move your tongues?
No.
So do you have a hard time to swallowing?
No.
No? Perfect. So as I see it, the patients just patients has a midline, so I don't see it any like a problem on like the throat is a midline, so I don't see it any right side or left side or dislocation. So okay, perfect. So we're going down. Do you feel any pain on your neck?
No.
Do you have any problem to moving your head or your neck?
No.
Have you ever had these problems?
No.
Okay, perfect. So what about your shoulders, your hands? Have you ever feeling any inflammation, any muscle pain, any numbness in your finger or in your hand?
No.
Do you have a hard time to carrying this stuff?
No.
So, okay, what about your chest area? Bless you.
Thank you.
So, I'm sorry, I don't remember, but I want to make sure. Do you have any food, medication, or environmental allergy?
No.
What about latex allergy?
No, I don't.
No, perfect. What about the chest area? Do you feel it? I'm sorry. Do you ever have any hives, any rashes on your
No.
chest area? What about tightening or pressure on your
No.
chest? Have you ever feel of shortness of breath?
No.
So have you ever feel it like you cannot breathing or it's hard time for you to breathing? Do you coughing?
No.
No? Okay, perfect. Do you remember when was the last time you get sick?
3 months ago?
3 months ago. And did you finish it all the medication doctor prescription for you?
Yes.
Perfect. So have you ever seen any discoloration on your knee, on your nails?
No.
No. Do you feel any pain on your nails?
No.
Are you able to move it all your fingers? Okay, perfect. So do you feel it any pain on your wrist?
No.
Okay, perfect. When was the last time you do the pap smear?
It was a year ago.
A year ago. So, and is it any abnormality?
No.
So, since you are sexual active, the consideration you do the yearly, the pap smear, and if you see it any abnormality, we want you to keep going follow up to
Uh-huh.
see the treatment. Okay. Another question. So about the breast exam, do you do breast exam every month?
Myself,
Yes, for
I
yourself.
do it in the bath.
In the shower, perfect. We asking every month, almost like every month, same day. So you checking on the bath. So if my patient was a guy, I will be ask the patients to checking their testicle, same in the shower, make sure there's no nodules, no deformation, or nothing those problems. Okay. So have you ever had any head surgery?
No.
Any broken bone?
No.
Like any hip broken, knee broken, elbows, shoulders. Okay, perfect. Do you feel it any pain on your knees?
No.
So do you ever feel it when you're exercising or walking?
Sometimes.
Sometimes. Okay. Do you take any medication for that?
I take ibuprofen.
Either. Do you know the dose you're taking?
200 milligrams.
200. And how many do you take it usually when you have a pain? Two, like 400 total?
400.
So is it over the counter or prescription from
Over
the
the
doctor?
counter.
Over the counter, perfect. Do you see any nodules, any moles, or any discoloration through your legs?
No.
What about your toes? Do you see any discoloration?
No.
Do you have a plantar fasciitis? It's on the palm of your feet. Do you have a problem on that, or do you feel it any pain on that?
No.
Are you able to move it your legs? Perfect. Do you feel it any numbness or tingling on
No.
those? Okay. And do you use it any cane, walker, or any walking devices?
No.
Have you ever used it?
No.
Okay, perfect. So, do you have a children?
No.
Okay, perfect. So, my other question is, I wanted to ask you, do you have any siblings?
No. I don't.
Okay, perfect. Does your mom and your dad alive?
Yes.
Perfect. So my question is, does your mom or does your mom have any health condition?
No.
She doesn't have cataract or diabetics or hypertension.
She has high blood pressure.
High blood. So mom has the high blood pressure. Okay. Any other condition? Her mom.
No.
Your mom.
No.
What about your parents of your mom, which is your grandparents, from your mom's side? What are they alive?
No, they passed away.
So, sorry for your loss. So, do you remember what age they are dying?
My grandma, she was 80.
Grandma,
My grandfather
it's
was
80.
82.
Grandfather is 82. So, do you remember what caused their death?
Yes. My grandfather had the thyroid cancer.
Thyroid cancer. Okay.
And my grandma, she had just like high blood pressure.
High blood pressure. Okay.
She's
High blood pressure. Have you either your mom or your grandparents have a heart problem? Your mom's side, like heart condition.
No.
Okay. Have you ever have for your condition? Have you ever had a heart condition?
No.
No. Okay. Perfect. So how about your dad? Does your dad have any specific health issue he had it?
He has high blood pressure.
High blood pressure. So dad has a high blood pressure as well. Okay. What about your grandparents from your dad's side? Are they alive?
No, they passed.
Okay. Do you remember what age they passed?
My grandma was 81. My grandfather was 84.
81. Grandfather 84. So, and can I ask you what condition your grandma from your dad's side has it?
They both had the high blood pressure.
High blood pressure. Does your mom and your dad taking any medication for their high blood pressure?
They do.
So do you consider yourself like, do you regularly checking your blood pressure?
Yeah, yes.
Usually when the patients have the high blood pressure going through their family, so we asking the patient to consider that, and I wanted to asking you to follow with the doctor and always like checking your blood pressure. So since the patient have a generic hypertension, so I wanted to make sure patient doesn't follow up with the doctor and also checking her blood pressure. So make sure because she's in a high risk to have it now. Okay. Do you know what is UTI? No, UTI is urinary tract infection. Have you ever had infection?
No.
No. Okay. Have you ever been have you ever been pregnant?
No.
Have so it means like you never been pregnant ever?
No.
Okay, perfect. So when was the last time your period?
2 weeks ago.
So are you getting your period on time every month?
Yes.
Okay, and how about your characteristics of it? Do you have cramping? How much is your pain? Like,
I have a little bit of cramp in my
Mhm.
my
under your belly?
my stomach.
Stomach? Okay,
Yeah.
perfect. Usually your period is a heavy bleeding or like not that much heavy?
Moderate.
Moderate, perfect. So what do you taking when you are period? Like what kind of medication do you taking for your cramping?
I usually don't take anything. If I need, I take Advil.
Advil. So ibuprofen is the same dose, 200 milligrams?
Yes.
Okay, perfect. So my question is, and I'm asking again, do you get period monthly, every time?
Every month.
On time? So have you ever missed any period?
No.
Okay. So have you ever diagnosed with any cyst or any ovarian or any uterus problem?
No.
No? Okay, how about when you go to the restroom? Do you getting any burning sensation?
No.
Do you smelling any abnormality?
No.
No, okay. But what about your bowel movement? When was the last time you had bowel movement?
This morning.
This morning. How about your bowel movement? Is it regular bowel movement?
Regular.
Regular. Okay. Do you feel any nauseous or any vomiting?
No.
Okay, so and have you ever had these feelings?
No.
No? Okay. So any food or something is not gonna be cause you any nauseous or
No.
okay. Do you in your home or so do you wear seatbelts when you're driving?
I do.
Perfect. So I want to go about like a psychiatric questions. So have you or any of your family, your mom and your dad, have anyone had a depression? You
No.
or your parents? Okay. Have you ever thought of suicide?
No.
So have you ever feeling to hurt yourself or hurt anyone else?
No.
So anyone in your family, have they have these thoughts on their families?
No.
Like your mom, your dad? Okay. So my other question is, what about secondary, smoker? Does your mom or your dad smoking?
No.
What about alcohol? Do they drink?
They do.
They do. Is it like they are a drinker or same as yours?
No,
It's just
same
like
as me. Party drink.
okay. And do you know what kind of drink they
My
usually?
dad, he usually gets beer.
Uh-huh.
My mom usually wine.
Wine. Perfect. So, and you said you do not have any siblings.
No.
So, okay. Perfect. So, what about your husband? Does he smoking?
No.
Okay. Perfect. So, my other question is, do you have a running obesity in your family?
Obesity?
Yes, like people
No.
like gain. Okay. Not in your mom's side or your
No.
dad's side.
No.
Okay. Perfect. So, have you ever except thyroid cancer? Have anyone in your family, your mom's side or your dad's side, have anyone had any ever cancer?
As I know.
No? Okay, perfect. So, no cancer in your family. So let me see. Have anyone have a heart issue?
No.
A respiratory issue?
No.
How about like genetic disorder like Hashimoto's, Huntington?
No.
No. How about anemia?
No.
And you said the only issue they have is hypertension.
Yes.
Okay, perfect. So, is there anyone in your family? You said they doesn't have a thought of suicide. Let me see any other question I can ask you. I almost covered everything, I believe. Let me see. So I'm asking about like eye exams, ear exams, teeth, chest, woman, period. So you're not menopause yet?
No.
No, perfect. Do you have a decision to having the baby soon?
Not soon.
Not soon. Okay, perfect. So you're working. Oh, have you ever had a feeling of stomach pain? Like stomach pain regarding like feeling uncomfortable
No.
after you eating your food?
No.
So have you ever diagnosed with any liver problem?
No.
So in your last lab result, does anyone tell you so you have a high liver enzymes?
No.
So do you have abnormal mold or discoloration on your skin around your body? So what about skin cancer? Is it run in your family?
No.
Your mom's side, your dad's
No.
side? Okay, perfect. Um, thyroid, you told me. I'm asking about that. Is there anyone in your family have arthritis?
No.
So how about you? Do you have any arthritis? Okay, perfect. What about low bone density? Like no? Okay, what about your mom, your dad? Okay, perfect. Is it any so you said you do not have an allergy to any foods and latex? Okay, I think that's also for this session. We are not going to be checking the patient hands-on. We go over like a health consideration about the patient. I almost cover everything on the patients, and we will see what we can do for the next video. Thank you so much.